Heart palpitations. After eating, heart palpitations feel like your heart flutters, pounds, or skips a beat. Certain ingredients in food, such as sugar, carbs, or salt, can cause them. Supplements, medications, and other factors can also play a role. Heart palpitations after eating usually aren't harmful. Contents overview symptoms and causes, diagnosis and test management and treatment prevention. Outlook. Prognosis, living with. Overview. What are heart palpitations after eating? Heart palpitations feel like your heart races, pounds, flutters, or skips a beat. You may notice your heart rate when you have a palpitation, or you may feel your heart beating in your throat, neck, or chest. Heart palpitations can happen anytime, including after or while eating. Though palpitations can seem scary, they usually aren't dangerous. How common are heart palpitations after eating? Heart palpitations after eating are very common. They may occur if you have food allergies or sensitivities. An increased heart rate happens to many people throughout the day, but you're more likely to notice heart palpitations when you aren't distracted. You might sense them when you're sitting still, resting, or lying down. Symptoms and causes. What are the symptoms of heart palpitations after eating? Symptoms of heart palpitations include fluttering. You may feel a flapping or fluttery feeling in the chest. Your heart can feel like it's doing flips. Irregular heart rate. Your heart might feel like it's skipping a beat, beating out of rhythm, or speeding up and slowing down. It can also seem like your heart stops for a second or two. Pounding. You might feel like your heart is beating very hard. Some people who have heart pounding say they can hear their heartbeat in their ears. What causes heart palpitations after eating? Usually, heart palpitations are harmless. They can occur due to the chewing, swallowing, and digestive process, or because of ingredients you eat. Most palpitations don't mean you have an underlying health problem. What foods can cause heart palpitations after eating? Foods that may cause heart palpitations include high carbohydrate foods, which can spike blood sugar levels, particularly if you have low blood sugar, hypoglycemia. High sodium foods, such as processed or canned foods. High sugar foods, especially if you have hypoglycemia. Spicy or rich foods, which can cause heartburn and sometimes a quickly beating heart. Certain ingredients in food may also trigger heart palpitations. Monosodium glutamate, MSG. Processed foods and some restaurant meals may contain this flavor enhancer. People who are sensitive to MSG may have heart palpitations. Theobromine. Chocolate contains this naturally occurring compound found in cacao plants. Theobromine can increase heart rate, which leads to palpitations. Pteramine. Alcohol, aged cheeses, cured meats, and dried fruit contain this amino acid. Pteramine can raise blood pressure and cause heart palpitations. What supplements can cause heart palpitations after eating? Taking dietary supplements with meals can sometimes lead to heart palpitations. These supplements include bitter orange, taken for heartburn, skin health, and weight loss. Ephedra, taken for colds, energy, and headaches. Ginseng, taken for energy. Hawthorn, taken for heart conditions. Valerian, taken for anxiety, depression, and sleep. What medications can cause heart palpitations after eating? Certain medications, which you might take with food, can also lead to heart palpitations. These medications include allergy, asthma, and cold medicines, antibiotics, diet pills, heart disease medications, high blood pressure medications, insulin, thyroid medications. Are there other causes of heart palpitations after eating? Other causes of heart palpitations related to eating and drinking may include anemia, low red blood cell count, which can result from a lack of iron in your diet, dehydration when you don't drink enough water, drinking alcohol, which may lead to atrial fibrillation, irregular heart rhythm that starts in the heart's two upper chambers, feeling anxiety or stress before, during, or after a meal, low potassium levels, hypokalemia, which can cause arrhythmia. Less commonly, heart palpitations after eating can be signs of a heart condition. If your heart often races after eating, see your healthcare provider for an exam. Seek help immediately if you have palpitations and chest pain or trouble breathing. Does caffeine cause heart palpitations? Caffeine is a stimulant found in coffee, chocolate, energy drinks, tea, and soda. Providers used to think that caffeine led to heart palpitations. But recent research suggests that, in moderation, up to 3 cups a day, caffeine may actually have heart benefits. If you drink more than 3 cups per day, you may notice palpitations. That said, some people may be particularly sensitive to caffeine, even at low levels. Also, in rare cases, Drinking large amounts of energy drinks high in caffeine may cause arrhythmias. Diagnosis and tests. How do healthcare providers diagnose heart palpitations after eating? Your provider will listen to your heart to check for murmurs or other sounds. They will review your current medications, including herbal supplements, diet, lifestyle, medical history, symptoms. Your provider may recommend a blood test, complete blood count or CBC, to look for anemia or low potassium. They'll also check for a thyroid problem or other health issues that could lead to heart palpitations.